your tongue with it just to simulate, but I know you won't puke on me. Since you just ate lunch.
Gag reflexes there.
We're gonna go ahead and say don't eat lunch before video slaps.
Oh, she's in the whole deal.
Okay,
Yeah.
so to
She's
do
on
it,
crazy
I'm not
legs.
gonna go through my whole, I use my hand sanitizer and
She
stuff,
does.
but
She's
you've
short.
introduced yourself, you've done vital signs, checked pain, all that fun stuff. Checked mentation, is she alert to her name, date of birth, does she know where she's at, does she know what year it is, all that fun stuff. And then we're gonna do our head, ears, eyes, nose, and throat. It does not matter where you start. Like I said before, I don't care if you start with the eyes, the ears, as long as you go in a good flow. I don't really care. We've inspected the scalp, so we're checking, for any lesions, pain, bugs, whatever. I don't feel anything, so I'm gonna check your ears first. Always look in the ears first. Do this exam because let's say they have like a ton of wax built up in their ear. Well, then you know why your hearing test may be a little bit off. You know what I mean? If you're whispering or doing the finger rub test, if they don't hear it, well, you know that their ears are full of wax. So, like I said, make sure you pull the pinna up and back. The ear looks good. I'm looking at the outside. Everything looks fine. There. And so I'm going to check cranial nerve number 8. I'm going to whisper a couple of words to you on the right side with your left. I want you to hold your ear closed, okay? Just repeat back what I say.
7 fall football.
Okay? And then we'll do the other side.
12 Howard nursing.
Okay, very good. So that was cranial nerve number 8. Alright, now I am going to look at your eyes.
You want us to say do you want us to say the number of the
Yes.
cranial nerve?
Okay.
I don't really care about the name so much. Like I didn't say it's auditory, but you at least need to either say, I prefer the number because most of the time if you're going to have a question, it's going to name the number.
Okay.
You know what I mean? And I almost feel like the name gives it away. Like you can figure that out. The number is what makes it hard. You need to know. So that was cranial nerve number 8 acoustic. So I'm going to check her eyes now. So the first one that I'm going to check, I'm actually going to check pupillary response. But I'm going to look in the eyes first. I want to make sure she doesn't have any like weird like ulcerations or injuries or anything going on, infection.
Cranial nerve.
Right now I'm not checking cranial.
Oh.
I'm just inspecting the eyes first. But then I'll start with number 2. Sorry. Okay. So just kind of look over there. I'm just going to look at your eyes and just make sure there's nothing weird. Okay. Close your eyes for me. I'm going to kind of palpate around. Does any of that hurt? Okay. So cranial nerve number 2 is vision. So I want you to read line 2 for me. You can just do it both.
874.
Okay, so cranial nerve 2, vision's intact. She can read. Okay, so 3, 4, and 6 make the eyes do tricks. I'm going to dim the lights. Theoretically, I'm not going to do it right now. I'm going to check pupils. So just look over across the room at the TV. Okay, and now I want you to follow my pen light with just your eyes. Don't move your head. And this is part of that 3, 4, and 6 make the eyes do tricks. And then she can focus forward. Okay, so that's eyes. All right. Now I want you to close your eyes and tell me what you smell. Alcohol. Okay, so that's cranial nerve 1, olfactory, and that's intact. Now I like to do 5 and 7 together, which is our trigeminal and our facial nerve. So I'm going to check sensation and movement of her face. So if you can, go ahead and clench your jaw for me. Okay, that's even. All that's good. All right, puff your cheeks. Okay, raise your eyebrows. Smile for me. Have you had Botox?
No.
Your eyebrows don't move very much. You're too young. Okay.
That's funny.
All right. So I'm
That's what you're
gonna.
gonna ask your patient. Botox.
Well, I do sometimes.
Funny.
Obviously, she's young. She has not needed Botox. Although the average age is like 21
I was
or
gonna say,
something, like it's
golly.
early 20s. But you think I'm kidding, but if you're really doing a good neuro exam on somebody, say they come in with a weird headache or something, and they don't have much movement of their eyebrows, I do ask. I'm like, have you had any kind of
Right.
Botox or anything? Because it naturally paralyzes, that's how it works. It paralyzes those muscles. And so I want to make sure that this is appropriate for the patient. You know
Isn't
what I mean?
Botox a treatment for migraines?
It can do
Migraines,
migraines too.
Right.
So I just like to make sure. Obviously, she's young, but she didn't have a lot of eyebrow movement, which is probably normal for her, and that's fine. And she obviously doesn't have a lot of forehead lines or anything, so that probably is normal for her. Okay, so I'm going to check sensation in your face. So this is going to be what I consider sharp. This is soft. Okay, so close your eyes and just tell me what you feel. Sharp. Soft. Sharp. Soft. Okay, that was good. Okay, so that was 5 and 7. Check movement, sensation, all that good stuff. Okay, so I want you to open for me. I'm just gonna look at your teeth and your throat and all that good stuff. Can you say ah? Okay, you ready? I'm not gonna gag you, I promise. Okay. I did the best I could. It's fine. Okay, now just stick your tongue out and move it side to side. Okay? So all that looks good. And that was cranial nerves 9, 10, and 12. Okay? Glossopharyngeal, vagus, all that fun stuff. Okay, this is accessory. This is 11. So shrug your shoulders. Okay, and then push your head against my hand and then do it again. Okay. So that was it. So that was our whole, like, head, ears, eyes, nose, and throat, and cranial nerves all together.
I like it that way.
It's hard though because you have to know the number. You know what I mean? If you're trying to go in order 1 through 12.